Hey friends, welcome to Chime Coaching. Rob here with my friend Nilesh. Do you happen to have a lot of questions about health insurance in America, especially for students? Stay tuned. All right guys, I'm with my friend Nilesh here, and he's going to talk a lot about health and medical insurance for international students. There's a lot of misunderstandings, a lot of problems that people face. So we're going to try and resolve all those doubts that you guys have today. If you're new to Chime Coaching, we love helping international students be successful in America. We want to cross and bridge cultures here. So please subscribe, hit that bell icon so you get notified on more great content that's going to come your way, and connect with us online with other social media platforms so we can help each other out. Nilesh, why is it important for us to talk about health insurance?
So let's talk about health insurance. One of the important topics need to be talked, but it's not talked. And a lot of international students don't have much information on it. It's only when you hit some injury or you have to visit a doctor and then you get a big bill from your doctor, then you realize, okay, that's an important topic. Why the health insurance is important in US. It doesn't work like your home country, maybe in India. The medical system is way too different in US. Medical costs are really high.
Way too expensive.
Way too expensive. So I can give an example. Say you have to visit, say, an eye expert in India in a decent hospital. The consultation cost will be around 300 to 600 rupees. In US, if you have to visit an eye expert, first thing is you don't get an appointment like immediately tomorrow. You have to wait some days because doctors are less, population is high. Second thing, the consultation charge will be somewhere around $300 to $600 depending on that doctor. So you can do the math. Just to see an eye doctor for a small thing for your eye, you have to pay say $300, and $300 will cover your rent for 1 month. So that's the math. So it's very important for every student coming in US to know about US medical system and the health insurance.
And everyone has to have it here.
It has to have, yeah.
And so it's something really important. It's not like you can just go pay out of pocket.
Right.
Where in a lot of other countries around the world, it's either free or very affordable. It's not like that in America. A lot of things about insurance are mandatory, either by the university or by the government, and that's always changing, which is even harder to follow. But even the colleges have regulations and with health insurance for students. So, Nilesh, despite the differences and the importance of health insurance, what are maybe some of the mistakes that students make here with the health or medical insurance?
A lot of universities, it's compulsory to have their university insurance, but then universities allow waiver if you have some other insurance. So there are a lot of cheap insurance which basically charge you very less premium. They are sold by a lot of vendors, a lot of websites, or a lot of companies, but then students don't go and see their benefits. They don't compare the plans. They just see, okay, my university insurance cost me $2,000 a year and some XYZ insurance cost me just $400 a year. So, okay, I'll go for the $400 insurance. But when you have less premium, you have less benefits, there are more conditions, and nobody compares that. Another thing is, it's not that you meet an accident daily, right? So you don't need your insurance daily. It may happen only once, and you should be ready to cover your risk. And that's what you pay for, that covering the risk, okay? So if you hit the accident and you don't have a good insurance or you don't have any insurance at all, you're gonna get like robbed by that hospital or a doctor. That's for sure. And in US, I didn't find much government hospitals or government health hospitals where even if you're dying, you get all the service for free. It happens in India. You have like very cheap government hospital and they pay, they give you the decent services and you pay very less, but that doesn't happen in US.
Nilesh, do you have any examples or crazy stories of how people have faced this health insurance issues with sickness or injuries? Or I know you've probably got many. What are a couple we can share to help people understand?
So I have one funny story. It's not funny for that guy who paid like $5,000. So a friend of my friend, he had a teeth injury, or I guess it was a decay, and he didn't have a dental insurance. People suggested him, take a week off, go to India. It was a off season, so he would have got a very cheap ticket and then get it treated. So he didn't do that. He just postponed it, and he didn't even buy the dental insurance. So later on, his decay became worsened, and he was not able to bear the pain. So he had to go to the dental hospital to get his tooth removed surgically, and it cost him around, I guess, the whole treatment along with the tooth extraction, the medicines and everything, it cost him around $4,500.
Wow.
And funnily, we say you can replace your whole jaw in India with that amount, and that's true. So he didn't have insurance and he paid that much price.
So is there anything that people should consider doing before they come and study in terms of health and medical wise to save money here in America?
One of the important thing is when come from India, make sure you do your all health checkups. If you have any previous conditions, if you have any ongoing conditions, you identify them in India. So your Indian doctor can suggest your treatment plan. You should be aware of that. Consider like you don't know that your blood sugar is high, and you come to US and suddenly with a blood test you realize your blood sugar is high. You are in a shock. You are in a different country on a tight budget, and then you are in a shock. So important thing is getting your all the health checkups done in India, getting your dental checkups done in India. Any treatment, any procedure you have to do on yourself, on your dental things, make sure you do it in India. So this way you can save some money. Second thing is you know that you know your health very well. So if you need any medicines, especially prescription medicines or over-the-counter medicines.
And what's the difference between those two?
Good question again. So prescription medicines are basically those which cannot be sold you without a prescription of doctor, and in India a lot of chemists they sell it without the prescription, but it never happens in US that way.
It's very strict here.
Very strict here. So you need to have a prescription, and to get a prescription you have to visit a doctor and you have to pay him a consulting charge. So, and another thing, over-the-counter medicines are those which do not need any prescription. You can buy it in a small pharmacy or grocery store maybe.
Yeah.
So this is the difference. So make sure whatever over-the-counter or prescription medicines you want, you get them from India. And along with those medicines, you should have a latest prescription copy from your doctor. So if you get stopped at airport, you can show that to the authorities saying, these are your regular medicines, you need them, and they will allow you to carry, unless those are banned in US. So you have to do that study as well. A couple of medicines may be available in your home country, but they may be banned in US, so you can't take them in. So yeah, these are the tips I'll suggest like you do before coming here.
What are some of the key terms or words or terminology that are used in the health insurance here in America that students need to learn and what they mean?
So there are some different key terms and terminologies used in US health insurance system, and you need to know them and their meaning before you compare the plans and you decide which insurance you want to take. So first thing is deductible. You may think like you pay for the insurance and you get the insurance, you don't have to pay a single rupee to your doctor or single dollar to a doctor. That doesn't happen.
It's not free.
Yeah, so we don't have everything free, even if you are having like a high paying plan. So deductible is that amount you have to pay to your doctor before your insurance cover gets kicked in. So say your university plan have a deductible of $300 and you happen to visit a doctor and he charges you $100. Insurance is not going to pay a single dime for that unless your $300 spending is completed within that period. So that first term. Second term is lifetime or the yearly maximum limit. A lot of insurance they have upper limit on the maximum limit that insurance can pay. And a lot of good insurance provider they have no limit. So it depends on your need and your requirements. Third thing is the copay. So a lot of time it happens that when you visit a doctor, your frequent visits, or you visit a primary provider or a specialist, you have to pay certain amount along with the amount insurance gonna pay. So say I visit a specialist, I have to pay $40 as a copay. That amount depends on a plan, and then remaining consultation charge or amount will be paid by your insurance to that particular provider. One of the again important things is premium. So how much premium you pay, whether that premium is paid monthly or yearly. There might be a discount when you pay it one time yearly. That's important factor to check. One more thing is out-of-pocket expenses. So a lot of good insurance will have an upper limit on out-of-pocket expenses. So what is out-of-pocket expenses? Say I visit a doctor, some of my bill is not covered by insurance, and then I pay that out of my pocket as cash. So that is considered towards out-of-pocket. So say I'm in a big recovery or I'm in a big hospital and a lot of things I have to pay out of my pocket. So my insurance may have out-of-pocket limit of $5,000. If I cross that limit, nothing which is from that bill will have to pay it by me, and everything will be covered by my insurance. This is one of the important things if you are facing some critical health conditions. So these are few important terms you should understand before you compare the insurance benefits and the company.
Yeah, and I've heard a lot of bad stories of my student friends who had sickness, health problems, injuries, but didn't get them treated right away because they were scared of the cost. They didn't know how the insurance would work, and they didn't get quick treatment, and things got worse. Or so yeah, it's so important to know these things. Know what your options are, know what you can do, so you're not scared. That's the biggest thing, is you don't have to be scared, and you should be able to take care of yourself and be healthy while you're studying and working here in America.
Hey friends, thanks for joining us in this video with me and Nilesh. Hope you learned so much about how health insurance works to really navigate this complicated thing. So yeah, be sure to follow Nilesh's advice, and please be sure to watch our second video about what to do and how to prepare to know about your health insurance before going to the doctor, and also how to save money and reduce the costs of health insurance expenses here in America. So be sure to watch that second video with Nilesh on health insurance, and best of luck. We want to see you guys succeed here in America. Thanks so much for joining us in Shine Coaching. Cheers, friends.